Welcome. We have Amanda here. Amanda had a breast reduction operation about 6 months ago, and we were going to try to sit down with her a little bit and talk about what her experiences were, what the process was like, and what she's able to do differently and how she's feeling now. So, Amanda, why don't you tell us what brought you to see me in the first place?
I've always had concerns about my breasts being too big. I was insecure about them. I always thought about having surgery, just never saw myself actually going through the process. There came a time where I was unhappy with my appearance, very frustrated with limitations of clothing that I can wear. I needed to do something about it. So I actually looked into having this surgery. You, Dr. Kutty, came, highly recommend it, and it just went from there.
And you know some people who had this surgery before, or you knew through the internet. Is it kind of from research, or it was somebody that you had known personally?
I did a little research initially, but I actually did speak with one of my colleagues who had the procedure done herself.
It is extremely difficult to find clothes. It's the having to buy different sizes of bathing suits, really commonly 3 sizes apart.
Yes.
From top to bottom.
Mm-hmm.
And you had a lot of that.
Yes. Not only was it difficult to find clothing, it was difficult to find the proper garments to hold that weight to properly support you, and it wasn't feasible.
Even if you work in an office where it seems like you're not doing a lot of exertion, you have to sit at a desk for a long period of time. It's trying to sit for more than a couple hours.
Yes.
For a lot of women is pretty tough.
Yes. I had pain in the back. My bra straps were tying into my shoulders. It was just really, really heavy. Caused numbness through my arms on to my fingertips. I was always uncomfortable, always popping my back. I spent hundreds and hundreds of dollars on massages for just a temporary fix. And I finally got my permanent fix.
Yeah, there are a lot of things that women do to get around it by going to the chiropractor. They go to the massage therapist.
Yes.
And for some of them, when the back pain's bad enough, they'll end up seeing orthopedic surgeons, spine surgeons, getting lots of injections and other kinds of things, and trying to work their way around having to have an operation to do this. But it's kind of one of those things where if you can get over the hump and feel comfortable about having the operation, then all of that other stuff goes away. Your life is pretty different now.
Yes.
Different clothes,
different clothes. I'm more active. I'm able to actively work out. I had limitations. Didn't really feel comfortable doing jumping jacks and push-ups. Just too heavy. It wasn't effective. So I needed to do something about it.
I think for a lot of women, they get kind of nervous when they're thinking, well, I'm going to have this operation. I'm still going to be a Blvd. The important thing is to make sure that the symptoms are gone, but it doesn't have to be really, really small in order to do that. Most of the time, if it's lifted properly and it's shaped a certain way and it fits the person's body, that they will have resolution of the symptoms without having to be really small. And I think what I've found is that some women who've been dealing with it for years and years, they just say, I don't care how small it is, just take it. And they'll find that if it's done proportionally, then they feel great. They're able to do whatever they want to do. And
I wanted to make sure that I was well proportioned, and I wanted to keep the sex appeal. So
yeah, to have curvy.
Right.
Curvy,
so
yeah,
I'm happy.
and also everybody's going to have a different idea of what they want to look like, and people from different parts of the country or ethnically, and everybody's got a different idea of what they want their body to look like. So it's when we see people, we talked a fair amount the first time I saw you, and I think a lot of patients, when they start looking into this kind of surgery, since it's a lot of times it's looked at as kind of a standardized operation, so you don't really get a whole lot of information about it, but also the surgeon doesn't get enough information about what it is you're trying to look like.
Yes.
Which is a big part of it. It's not just making it smaller.
It is.
And then when you come out of the operation, you actually look the way you want, because they're thinking, I want to buy these clothes and look this way in a tight dress, bathing suit or whatever, and then if it doesn't happen, then they're happy about the pain being better. But just because the pain is better doesn't mean you're going to be thrilled.
With your appearance.
Yeah, you want to be able to still look really good.
Yes.
And accentuate the figure that you have, like here.
Right.
Where her figure's terrific. And you had a really narrow waist, but you could not see it because everything was sitting in front of it. And because what's your height is 5?
I'm 5'3".
3, yeah. So unless you can really get a sense of what the size of the middle is, then people just look like they're straight up and down and you can't see anything.
The final straw for me was I had to wake up early to go to the grocery store. So I just threw something on. And I ran into one of my classmates, and I had a very loose fitted t-shirt. And she's like, "Oh, Amanda, it's so good to see you." And she said, "Oh my God, I didn't know you were pregnant. How
Oh
are
no, that's
you?"
the worst.
And my breasts, they stood out so heavy because you couldn't see my waistline if I had loose clothing on, so I was always trying to wear something tight or anything like that. But this one time I went to the grocery store and she thought I was pregnant. I couldn't do it. I can't.
Yeah, usually women are pretty good about not doing that.
Oh my God.
Mostly it's the men who make that mistake.
Yeah.
You can really tell why it's not possible to hide that.
Yes.
Because the size makes them sit in front of your waist. So it doesn't matter what tight dress you have, or if you wear a waist trainer or a cincher or anything.
Yes.
Yeah, you can't hide that.
Right.
And until that's out of the way, that you don't get that figure. But there's a lot to consider when you're having this operation, because you want to make it look better as well as feel better and function better at work, and functions and the way your clothes fit and all that. So the figuring out the appropriate proportions and the size and all that, and even the appearance of it, as far as how it's lifted, where the fullness is, and the position of the areola and all that other stuff, in order to make it so the patients are really happy with it and they don't have scars all over the place. But the incision is kind of an anchor shape, but not the one that you may have seen if you were on the internet, where it goes around the areola straight down, and then some women will have this incision that goes all the way across, and it's so long that it actually is visible in the middle. And what you kind of have to do is think ahead, where if it's lifted up and smaller, then this area is actually exposed, then it's not covered up by breast tissue. So if there's a scar that goes all the way in there, then you can see that. And my feeling is, if you're going to do this and you want to be able to wear nicer clothes and smaller things like bathing suits and lower cut dresses, if you have a scar that comes all the way up into you,
it's obvious.
Yeah, you're not going to want to do that anymore. So all those things have to be factored in. And there are some women where you can't do it without having those incisions, and even those patients are thinking of it as a trade.
Right.
6 months.
Yeah,
so
it's been 6 months now.
idea.
I'm healed good. Didn't really know what to expect as far as the scarring. I knew there would be some, but I believe it's minimal because it's not dark. I took care of it like I should have, per your instructions, and I'm just ready to.
Yeah, to enjoy yourself.
Yes.
The scarring is a big deal. I mean, for anybody, and it's because of the part of the body that it is, and it's really part of women's kind of self-image.
Right.
If it's smaller but it's covered with scars, then it bothers the women so much that they don't really get the whole benefit of it. But I try as much as I can to plan where the incisions are and how long they are and what I can do with a given incision, so that I can make it look really nice, but then you don't have scars in a place where it's going to be really visible.
Right.
Because if you want to wear like a bathing suit, this part is important, but also how far out it goes on the side. We're really careful about making sure that when the patients are just post-op and things have initially healed, that we're doing everything possible to lighten up that scar and make it so that it's not an objectionable scar.
Yes.
And it's not something you're embarrassed about or you're thinking about all the time. But yours are pretty well faded.
Yes.
And the color match is pretty good.
Yes.
And for patients who have pigmented skin, and I have the same experience with it when I get a cut. It's really dark for a very long time, and because of that, I'll actually have those patients come back every you know, every few weeks at the beginning, and then every couple of months after that, so we can make sure that it's all headed the right direction. The initial the first couple of months are really important.
Right.
And, you know, seeing you a couple of times during that period to make sure that we could get you started with whatever you needed. And a lot of it is we're actually doing what you're supposed to do.
Yes.
I think I usually have people come back a little more often than a lot of other patients who have this kind of operations because of that kind of thing. And, you know, I want the patients to be happy. And so you're smiling, so you must be kind of happy.
I'm really happy. I'm very satisfied
I'm
with the
glad
results.
I'm glad you did it. Yeah, I want the patients when they come back to just be happy
Yes.
and feel better and all of that, because that's why we enjoy ourselves
That's
here.
awesome. Awesome.
You know, Amanda, thank you very much for taking time to come here.
Thanks for having
And,
me.